I'll give you a little spiel what you're in for. You're in trouble. I like hearing myself talk. So we made her go first because she was quick, and I'm going to be here for a while. No, I'm just kidding. My name's Warren. I've been, actually, one of the biggest part of my job is preaching. Not like Jim, but to doctors. I speak around the country to doctors groups on obesity, hormone replacement, and preventative medicine. So I love when I get to talk to people that I can actually raise the bar a little, bring the intelligence up some, compared to talking to all those doctors. So I appreciate you guys a lot. I'm going to talk, this isn't a normal talk for me, just because I like getting into the real guts of stuff. So if I start blabbing so much, Jared, my dietitian in the back, who'll be speaking right after me, is going to start throwing cookies. Because I'm very anti-cookie. I will notice them. So
eat them anyway. Yeah. We got a few tonight. It's okay.
If you have any questions, interrupt me while I'm talking. Because I like to, I might even call on some of you. Make sure you're paying attention. No, but I want this to be interactive because it's important to really understand the way patients see things and the way physicians are trained to see things are very different. Very different. I was trained, as all Western trained physicians, to treat numbers. And unfortunately, Western medicine has really pushed that. I try to treat people. And I think that's a trend in our country. A lot of doctors are looking more towards treating the person and not just their numbers. So this presentation it talks about the numbers. And I want to give you some clarification of those. But more important than anything else is understanding, one, what do they mean, and two, what can I do about it? Because one thing I talk about a lot to my patients and when I'm out preaching is you have to have control of your own health. It is up to you. Don't leave it in the hand of your healthcare provider. Don't. Their intentions are great, but you still have to have control. So with that, we'll jump right in. These are all the same word, just different acronyms and whatnot. High blood pressure, hypertension, and HTN. Those are us who are lazy. That's the way we write, HTN, right? When we're writing hypertension, that's too long of a word. I spell it wrong half the time, so I just do HTN. That's what, if you see that, that means hypertension. Health is confusing, as these signs, and I'll read them for you. The top one says childhood obesity, don't take it lightly. And below it is a McDonald's, thank you, sir, McDonald's advertisement, and there's a Chinese kitchen over there. So it's confusing. How many people get confused by what you read in that great medical journal, USA Today? It's difficult, isn't it? It's confusing for all of us. And I'll be honest, even with all the reading and training and years of school, I still sit back and go, what is that supposed to mean? So I understand the confusion. So I am so impressed with Pocatello's healthcare providers. I was with and I trained at the Mayo Clinic back in the 90s, and I was a staff physician there for a number of years before we moved. And I can tell you, there's some of the best healthcare providers in the world there, but I would put anybody in Pocatello up against them. We're very blessed. The doctors here are excellent. And the nurse practitioners here are excellent. And the PAs here are excellent. So I encourage you to get to know your healthcare provider. And a lot of them, the neat thing I like about them, they're willing to have personal relationships with their patients. And that's neat. I give everyone my email. Most of my patients have my cell phone number because it is a lifelong, I want to say struggle. Struggle is not the right word, but it's a lifelong attempt of health. Health is never obtained like that. Just like disease. Disease develops over time. The exception may be motor vehicle accident. That's a quick onset of disease or injury. But lifestyle diseases, which we see and would guess, depending on who you read, 80 to 90% of the stuff that we see are lifestyle related. So hypertension, hyperlipidemia, I could just go on and on and on, are really have to do with what we do the rest of the time when we're not in our doctor's offices. So I will cover some of that. Risk factors for hypertension, and I'm going to, the same slide will pop up in a few minutes here and give you what to do about it. Age, race, inactivity, weight, BMI, body mass index is what that stands for. That's a ratio of your height to weight, basically. Greater than 25, or percent body fat, greater than 25% are risk factors for hypertension. Your diet's a risk factor, processed foods and salts particularly, sugary drinks, and that includes healthy fruit juice, anything with sugar in it, does raise your blood pressure. Alcohol is another potential, and as a matter of fact, a study just came out last week saying that even moderate alcohol in some can really elevate blood pressure, up to 20 points systolic, and that's moderate intake. And we've been told how healthy moderate intake is for a long time, so it's something to be aware of. And then stress. Anybody have stress in the room? We won't go there, that's a different lecture. Other risk factors, obesity is a risk factor in and of itself. Poor sleep, whatever the cause. Sleep's a big thing. We see a lot of sleep issues, and it seems to be more prevalent now. The number one reason I'm consulted is fatigue, and so sleep's involved there. So sleep, we're going to talk about what we can do about that. Insulin resistance and diabetes, kidney disease, and that can be anatomical or genetic. It can be vascular, or it can be even caused by things we do. For example, taking too much ibuprofen, or a Aleve, or a Rutus. Those things, Motrin, too much of that hurts the kidneys and can cause blood pressure. It's very, very common. It's the most common condition taken care of by your primary care doc. As you can see, big numbers. By the way, I do not write like that. Do I, Jim?
Yeah, you do.
Oh.
Slightly worse, actually.
Thank you. The reason we're so worried about blood pressure is there's a very close relationship between cardiovascular or any vascular disease or organ damage, which I'll talk about in a minute, and the actual numbers. Okay? Cardiovascular events, strokes, kidneys, we find our lowest risk at 115 over 75. And let me give you a little history on that, because I'm not going to talk about it directly. Something was just released this last year and a half called JNC 8, Joint National Commission 8th meeting. And the last one, JNC 7, was 10 some years ago. Those are when all the gurus in blood pressure in the world get together and they decide to make a policy and some suggestions on what's optimal treatment, what's optimal numbers, whatnot. One of the biggest differences, as I have a very large geriatric population taking care of a number of nursing homes and whatnot, is in that field. I used to call JNC 7 had the limbo approach to blood pressure, low as you can go. But we had too many people falling over and breaking their hips. So JNC 8 is a little better about that. But still, it's been found that the ideal risk factors for lowering risk factors for blood pressure is around 115 systolic and 75 diastolic. What those numbers mean, that top number is the pressure in your vessels when your heart contracts. Okay? So it contracts, that's a pressure. We call that systolic blood pressure. And then when the heart relaxes, there's still a pressure in the vascular system to maintain blood flow to end organs. That's called diastolic pressure. And different types of heart disease, different types of kidney disease, different types of medical problems change those numbers. And that's why your doctor might not be so worried about the high number, the top number, and be more worried about the lower number if you're a certain age group, for example. Or we might not be so worried about the numbers themselves, but the gap between them. There's a large gap between the top number and the bottom number. That's an eyebrow raiser. So there's a lot of stuff that your healthcare provider will look at and go, I need to interpret this a little more, understand it a little better. But that's what systolic blood pressure means. When the heart contracts, that pressure, and when the heart relaxes, what's the pressure that's remaining? There's no evidence to really justify treating blood pressure lower than that. But we see it a lot. We see a lot of people come in on a lot of medications, especially if you have more than one healthcare provider. Your cardiologist starts one medication, your pulmonologist starts another, your OB-GYN starts a third, and then your primary care doc starts a fourth, not realizing, hey, that the others had done this. And we'd have people come in with blood pressures of 60 over 40, and their complaint is, Doc, I'm dizzy. Yeah, I can see why. So it's important too, and just a little side note, if you have more than one doc, be sure to tell your doc what you're on, including supplements. Very important. For every increase of 20 millimeters of mercury, so that's a measure of pressure, over that number, or 10 millimeters of mercury in the diastolic pressure, your risk of major cardiovascular events, such as a heart attack or stroke, basically double. I got asked, I use this slide because I think it's hilarious, but I did a big conference once, and I asked the audience, give me a title for this slide, and I'll give you one of my books. Anybody want to try? I'll give you a book. If you have the best title for this slide. Because then I'll tell you my favorite one, this young lady said. Any ideas? I'll start picking on you, I'll call on you. Yes?
Going nowhere fast.
Going nowhere fast, that's a good one. Someone else? What's that?
A bicycle built for few.
A bicycle built for few, that's good. My favorite, I'm gonna give it to her, nothing personal. I'll get you a book, hon. My favorite title of the slide was Bad Parenting.
She has a helmet on, was the comment.
Oh, well, good. And safety training wheels, right?
Yeah, so, you know.
So it's your dad's fault, not her mother. Right? Yeah. So basically, high blood pressure.
To do it.
You know, I would, yeah, I'd be right behind you. It's like fire hose to drywall. And that's an easy visual to understand and see. Fire hose has a lot of pressure. That drywall is eventually going to give out. And that's why we worry about those numbers and really pay attention to them in a medical practice or in a lifestyle optimization. That's something for you to be very aware of, those very important numbers. Just like our fine young lady talking about your cholesterol numbers. Very important to understand what those are, what they do, and how to modify them. So I have a speech I tell all my patients. I have a 4-organ speech for women, 5-organ speech for guys. And it's basically just, I'll read it so we don't have to say it because we're being filmed, okay? But seriously, when you have that fire hose, the little tiny vessels in your eyes, your brain, your kidney, your heart, and men, causes problems. As a matter of fact, I have a very large male population in my practice, and if they come in with any problems in that area, we rule out cardiovascular disease. First thing, because that's an early sign. So very important to know. So those are the ones, when I have people say, I'm not too worried about my blood pressure, doctor, I kind of remember to take my medicine. Most people are aware that they could have a heart attack or stroke with that number being too high, but they're not aware of the others. Other 3 in particular are mid.
Why does it bother the last one?
What's that?
Why does it bother the last one?
Small vessels. They get damaged, just like the drywall.
Okay.
They get damaged. So here's some basic goals, and these are basic, and that's why I loved what the young lady said. Forgive me, what was her name?
Jessica.
Jessica. She did a fine job, fine job. She talked about the individualization of treatment, and the same thing goes for blood pressure. Because in certain situations, particularly in the elderly or in some of my nursing home patients, I'm a little lighter on what the numbers actually are because of other risk factors, fall risks, for example. But on average, if you're greater than 60, your top number should be less than 150, and the bottom number should be less than 90, okay? If you're less than 60, we follow that bottom number a little more close. That diastolic blood pressure, the pressure that's left in the vessels when the heart's in between beats, what is that? For ages 30 to 59, that's a very strong recommendation. The way we in the healthcare world decide whether we want to apply something in our practice is based on a bunch of smart people's recommendations. And there's different grades of recommendations, A, B, C, D, and 1, 2, 3, based by the United States Preventive Service Task Force. So this is a very strong recommendation, and this is something I jump on in practice. If I have a 45-year-old and the bottom number is 95 pretty consistently, we're going to have a talk. And we're going to have that 5-organ speech, and we're going to do something about it. For younger people, it's an opinion. I think it's still a very valid opinion, because just like that drywall, eventually we're going to have trouble if we keep that water on it. If you're greater than 18 years old with chronic kidney disease, our numbers should be a little less. We got to protect those kidneys. Those kidneys filter all your blood. One of the most amazing organs in your body, those kidneys. If you're greater than 18 with diabetes or insulin resistance, in my practice, I include anybody with any insulin concerns. So that would be polycystic ovarian syndrome in young girls and women, insulin resistance you're familiar with, the metabolic syndromes that are named for, or actually frank diagnosed diabetes, then my pressures are going to be lower as well. Because having diabetes for your heart is, I treat you and we all treat you as if you've already had a heart attack. That's how powerful diabetes is as a risk factor. And I'm sure one of our parish nurse presentations will be on blood sugars and diabetes and insulin resistance here in the future. We'll get into much more detail about that. So how do we treat it? Let's talk about that. Well, obviously we can't change your age. That dog has eyes. We can't change your age or race, but that doesn't mean you can't be healthy and optimal as can be. I'm going to brag on a few of my patients. I have a couple mid-85, 86-year-olds, and they look like underwear models. They look wonderful. They're in great shape. They stay active. And if you ask them, what's the secret? What's the secret to it? They move a lot. That's what one thing they all have in common is they exercise regularly, they move a lot, and they really watch their diet stuff. I have a lot to say about diet because that's my favorite topic in the world, but I'm going to leave it for Jared. He has a great presentation coming up here in a minute.
Dr. Willey?
Yes, ma'am.
What about those of us who are somewhat incapacitated?
Mm-hmm.
I have stenosis of the spine, and it's gotten bad again because I tried to do the exercise thing and it wasn't right for my body.
Bless your heart. Wonderful question. When I say start moving, that means anything. I'm going to give you a little explanation. If I talk too much, Debbie, shut me up.
I will, you got about 6 minutes
Okay,
left.
I can do it in 6 minutes. Okay, when we think movement, we all think exercise. Exercise defined as getting up, going to the gym, getting on your bike, taking a walk around, and whatnot. But there's a more important movement, and we call that, Jared, what do we call it?
Neat spa.
Neat movement. Neat. Non-exercise activity thermogenesis. Neat movement is what you do the rest of the time during your day. So that's why we tell you park farther away from your destinations. Use the stairs instead of the elevator. A friend of mine at Mayo in Rochester, Dr. Levine, made these real fancy underwear. True story. Real fancy underwear that monitored people's movement. Why they were underwear, I don't know. You shouldn't say underwear and movement in the same sentence, probably. But anyway, it monitors activity. And he found that people that even twiddle their thumbs or tap their feet have less disease.
And I fidget.
I'm sorry?
I fidget when I'm sitting down.
Good. That's excellent. That's the type of movement. Because when you go totally blank, when you stare at a screen, which we're so good about doing these days, be it your phone, the TV, the computer, everything shuts off. So by twiddling your thumbs, tapping your feet, continuing to move, that's really where the secret is. So when you hear me say movement, that's what I'm talking about.
Maybe.
Good. Yes, yeah, you is right. Yes, exercise is ideal. Tim's going to talk about that in a minute. Yes, that is the best thing for you as far as if you had to pick an activity. But really, what you do the rest of the time is as if not more important. And that goes for any disease state. That goes for any weight loss attempt. It's movement the rest of the time. Did I see a hand?
Yeah, what's the best form of exercise you think?
Well, I'm a little opinionated, but it's resistance training.
Okay.
Well, she's incapacitated too.
And you know what? Getting soup cans and a towel and a chair, I can give you a full routine.
Yeah.
It would be wonderful for you. It doesn't. You don't have to belong to Goals to do an exercise routine. And that's what I think Tim will talk to you about. How do you incorporate an exercise routine with soup cans and a towel? It's really important just to move, and that's really what I emphasize. People give up their health attempts if they can't go to Goals, and I think that's a terrible thing. You don't necessarily have to. I better hurry because Dan's going to start throwing cookies. Weight, obviously, try to optimize your weight, work on losing the fat, avoid processed foods, particularly in sodium. The reason processed foods are dangerous is they're high sodium. It's very high. And again, Jared's going to talk a lot about diet here in a minute. Sugary drinks and alcohol, limit if it affects you. Stress, it's very hard to modify our stressors. Like I cannot change myself for my poor wife. I'm a huge stress for my wife. However, she can modify what her body does dealing with me. Does that make sense?
No.
And we do that by adequate sleep. We do that by adequate protein. Jared's going to talk about that, so we'll get into that. And of course, my favorite, the best thing to do for stress, and our wonderful pastor Jim's going to be doing a study on this, and that's the effect of church and our church body and our family and the power of prayer and how that modifies stress. Really neat thing he's going to be doing here, so I'm excited for him to present it and share it with y'all.
3 minutes.
That's it. Obesity, the fat's not necessarily the bad guy, but it is on your body. So Jared will talk some of that. Poor sleep, consider intervention. We have some wonderful sleep docs in town. I refer so many people, to the sleep docs in here because if you're not sleeping, it really does set everything up. It's hard to even lose weight if you're exercising 5 hours a day and eating perfect if you're not sleeping. It's recovery, it's very important. So I'd encourage you, if you have trouble sleep, talk to your healthcare provider about it. We can help you, it's very, very important. Insulin resistance and diabetes, watch your carb intake, exercise, talk to your doctor about medications if needed. If it's kidney disease, we have wonderful nephrologists in town, they're Heems, Dr. Hatterley, wonderful, wonderful people. Avoid anti-inflammatories if you can. If you are an ibuprofen junkie, be careful, be careful. And then we have medication, which I won't get into because that gets real messy, technical. So there's things though, with medication I think it's important to know. When you go to your healthcare provider, we ask ourselves about, in your favor, does starting medication for blood pressure improve health outcomes? That's why it's a very individual thing. And we also ourselves, do various antihypertensive drugs or drug classes differ in comparative benefit and harms? So that's why I decided not to go over each drug class or whatnot with you, because that's pretty detailed and it becomes very individualized. We use certain drugs in certain states, in certain conditions, certain people, certain races, certain age. There's just too much there. But it's important, and I know all your healthcare providers ask these questions beforehand. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day?
Thank you very much.